Assalamu alaikum. Good afternoon. I hope you all are doing well. Good to be talking about NCDs and right after you had your meal when you're in your post-lipemic state. So we'll try to, keep you all awake. And we're going to try to have this session allow us to catch up on time. So rather than 1 hour, which it was originally scheduled for, we'll try to wrap it up in about 25 minutes. So perhaps we had short introductions for both of you. We're going to talk about basically the role of technology when it comes to promoting healthy lifestyle. You've had some of that discussion already. We're going to talk a little bit about bottlenecks. So now this will be a little bit into technology, but you will have a few other things that we'll talk about in terms of NCDs. What are some of the bottlenecks when we talk about promoting healthy lifestyle? So without further ado, maybe I can throw one question. And this is a very generic question for each one of you. What do you think are some of the bottlenecks in Pakistan when it comes to care for NCDs? Perhaps we can start out with you, and then in fact, if you want to say something else in addition to your very short intros we did about what you do, and then the question would be, what do you think are some bottlenecks we have in terms of the care for NCDs in a country?
No, thanks a lot. I'm perfectly fine with the introduction. So look, I can give you an industry perspective. So for example, this is an ecosystem, right? So we have clinicians, we have different stakeholders, government, policymakers, and industry is one of the members of the ecosystem as well. I can give you an example how industry approaches. Personally, I have some experience of working in GCC. Past 8 years I've been working in GCC. I think what I see missing, if you want to see it directly, get into challenge, the game plan is missing, right? So we have pockets of innovation, we have sporadic excellence, but if we really, really want to grow, we need to have a game plan. Any organization, whether it's a hospital, whether it's an institution, whether it's a public sector, we need to have a game plan. What needs to be done? What is the purpose? Why are you doing it? Because once you have this, then you can put the resources in. It's not like you have $100 and then you can say, okay, fine, what will I do on $100? You need to have a 10-year vision minimum, and then you put your resources in, you plan accordingly. I can give examples from AstraZeneca. 10, 12 years back, it was up for hostile acquisition. The company changed things, they made a plan, and today it's in a very, very different state, right? I can tell you, because this is Health Summit, so AI technology is at the heart of AstraZeneca, right? Whatever we are doing, everybody is working on AI, whether it's research, whether it's commercial, whether it's supply chain. We have a couple of things. So there is something called A Catalyst Network. So A Catalyst Network we have in 22 hubs in different parts of the world, where AstraZeneca is working with different partners, collaborators, researchers, policymakers, government, to develop patient-centric outcomes, right? So what I'm trying to say is that, there is a strategy. We are using AI in our own working, plus we are collaborating with different stakeholders as well. When I come to, for example, how are we using this in the real world, we have multiple examples. For example, Cure AI is one of AI-based solutions, which we have started using in different parts of the world. I think 12 countries we are using. And what it does is basically scans, takes the X-rays and figures out if the person is at a risk of TB or cancer, right? Something similar is being done in India, which is TriCog, and they can detect ACS. So ECG is taken, it's sent to a central AI database. And then after this, it's sent to a group of experts as well. Within 3 days, not months, sorry. Within 3 months, 3 minutes, sorry, the data is sent to the hospital, and if there is cath required, all preparations are done. So what I'm trying to say is that, strategy or business plan is critical. We come from a commercial organization. Planning is required.
Okay.
Right? So I'll pause here. Maybe I'll let Farhan.
I do have a follow-up question, but I'll come to that once Farhan responds. So
I'll take this one. Acha, I'm glad that Khurram started and he has shared a few things. We also need to segregate different areas within this. You want to introduce them? Sorry. We'll also have to segregate a bit in terms of the need and then what can happen through AI and what has been done and what will be done. So we'll have to segregate that. So first and foremost, right now around 400 million people globally, they lack essential medical needs, which means that there is a finite availability of medical solutions, whether it's medicine, whether it's healthcare professionals, even the accessibility. Abhi, sir said, it's not just, it's also geography, if they are in the far-flung areas. Now, what AI or technology is actually doing is that's actually taking that medical solution to those people who are not even able to access it physically. Even those people who can access it physically, they don't have that data, they don't have that knowledge, which can help them improve their lifestyle, or they can improve their well-being, whether they need it immediately or in terms of self-care. Now, I represent Haleon here. Haleon is just a 1.5-year old organization. Although we were GlaxoSmithKline's consumer healthcare arm earlier. Self-care, we believe that will help in future, not just us as individuals or patients or consumers or customers, but also the governments in order to save a lot of expenditure or money that is actually spent. They say that's about 2.7% amount is being spent by the governments within the healthcare expenditure on self-care only. Even in Pakistan, how much budget do we have? Even in a commercial organization or a government organization, or even at the government stage, how much do we spend on multivitamins? Like, there was an initiative about 20 years back which was lady health workers. And the objective was that they would go to far-flung areas and tell people how much it is important to have that gap between pregnancies and what are the essential things that you should be consuming so that you are healthy and the child is healthy. Fast forward now, they're just going and helping women in their deliveries, in the mother-child post, with the complications and all. But what objective was something else, right? Mm-hmm. So what we also need to do is we'll have to take a step back as commercial organizations like Haleon, Estra, Novo, and other commercial organizations, whether they're multinationals or local, but also government. Because from policy-making perspective, we'll have to really think. Now, in commercial organizations, there are certain things that we do very well. Just for example, I know if 5 minutes pehle, which shop, which city, how much order was taken. Because there is an app. The person, when he goes in front of a shop, he will put an order. The app or through the AI will tell him that in the last 12 visits, this was the quantity that this shopkeeper actually bought. So if, for example, he bought 10, this time he's buying 8, then you should talk to him, convince him. So from commercial side, we are doing so well. But from AI or medical side, in Pakistan versus the rest of the world, I think we are a bit behind. But I'll talk about global area because we are one of the biggest in terms of oral healthcare, dental hygiene, because Sensodyne and Parodontics and McLean's, Aquafresh, they're all our brands. Haleon works with a lot of startups in AI on dental hygiene. Our initiative is Haleon Next. And what we're doing is, with a lot of data, because data is available everywhere, all of us are custodians of a lot of data. Now, they have huge data available. Through that, one of the startups that's working with Haleon Next, they're able to tell you that if you're brushing your teeth, what are the places that you couldn't brush properly, and what impact it can have, and the next time that it will tell you that this is how you should be brushing, or these are the areas where you should be, and that's a toothbrush AI that we're working. Here, the startups that are working, there are certain challenges, but we also need to understand that the healthcare professionals and the consumers are also not ready. One last bit, sorry, I'm taking a little longer.
No, I just wanted to bring you back to the question. We're talking about lifestyle. So what are the bottlenecks in terms of that you think are important when you're coming from an industry perspective? I think so. We can talk about a lot of things, but I wanted to bring it back to what the topic is, which is healthy lifestyle and NCDs. What are some examples from the industry side? No, please carry on. But I wanted to have some discussion on that particular question as to what.
Just involved, but
perhaps, Rashid, if you want to First, introduce yourself
Okay, thank you
to the
so
group,
much,
and then and I can come to the question as well, please.
Perfect. My apology for joining late. I was here at a 9, Shaukat, but unfortunately could have a little bit of a change in the agenda, so other things to manage. So my name is Rashid. I'm leading in a Novo Nordisk, which is a global leader in diabetes and obesity in Pakistan right now. It's been almost 26 years within the pharmaceutical industry. And I feel proud to work right from the basic level from a pharmaceutical to this general manager position. So maybe I can add a little bit of a more value on a grassroots level on the right mindset into the Pakistan, what's happening and how we can play our role.
Sure.
So that's a bit of my introduction.
Great. So I think the question we're discussing is in terms of healthy lifestyle when it comes to NCD prevention, what are the bottlenecks that you see from the industry perspective in our country?
First of all, my opinion on that is a bit of a little controversial to ask from a pharmaceutical to work onto the prevention side. So we need to justify it
So I was going to come
first.
to that. I was hoping somebody would say that.
We sell the medicine just for the treatment of the medicine, and why we want to protect for the people?
Exactly.
So one question.
That is my question to you, and I'm glad you brought it up because that's exactly what I was going to come to. That does industry have any vested interest? Now, industry, of course, has a few sides. So one side of the industry is medications, right, which I think some of you represent. I'm not sure there's a lot of vested interest there in prevention of disease because you need medications to treat disease. But there is other side of it, which is innovation, right, whether that is used of technology in terms of apps or other technologies that can lead to or promote a healthy lifestyle. So what are your thoughts? Would you be ready to support something like that as 3 industry representatives where you have a lot of products that are out there that actually treat disease? What incentive does the industry have in promoting healthy lifestyle?
If you ask me, as a Novo Nordisk, we are not ready. We are already into this field. And we are one of the most active in terms of the prevention and protecting to the people for this disease. Why I thrown up this point to the audience? Because they should believe on me what I'm going to say right now. Because this is already in my mind and I always answer to the audience. So this is why I'm not interested to sell my more products. Because at the same time, Novo Nordisk, if you see, because now I'm representing Novo Nordisk, of course, the pharma industry. But we have a purpose right now, and I'm sure the Shaukat is sitting here is in Denmark, the number 1 company who has a purpose. And purpose is that we have 3 major work and the business models. And one of them is, which is a 33%, is a social responsibility. We love to sell our product, we earn that profit, we take it back to the research and development, and then we pay back to the community as well.
Correct.
One is I'm a pharmaceutical general manager. But at the same time, I'm a Pakistani as well. So since I'm specialized in a diabetes prevention or the treatment or the management, so I can talk a lot about the diabetic prevention and all those initiatives. But I really wanted to take this opportunity to let the audience know about that. That why this is important for me as a general manager who is selling in a medicine to protect our nation. Mm-hmm. Right now, we are the number 3 in a diabetic population in the world with a 33 million diabetic population. And can you imagine who are we at 1 and 2? We cannot beat them at any cost because they are China and India. It's a huge population. If take them out, we are the number 3 in terms of the population, 33 million. And if you come to the prevalence, then we are the number 1 with 30.2% prevalence in Pakistan. And can you imagine what will happen after 2024, 2025? We will be the 65 million diabetic population in this country. Your and my child will be the part of this diabetic population. I can guarantee it. Mm-hmm. If we will not take responsibility right now as a pharma or as a commercial or as an institution or as a public, I think we are not going to protect our children, our families. So that is why this is a major purpose of Novo Nordisk, that we are, yes, earning profit, we are earning salaries, we are enjoying the benefits, but at the same time, I think we have to answer to our nation who actually born us. So that is the reason I'm coming back to the question. Sorry for building this base. So they will believe on me what I'm going to say right now.
So I wanted to summarize this discussion. I think that's the problem we face in Pakistan right now. If you look at actually an industry and a company like Novo Nordisk, which has one of the highest sales in the world in terms of diabetes and now very much into obesity as well, and they spend a large chunk of their earnings. It's a very socially responsible company when you look at amount of money that they spend on research and development. Even then, the money that trickles down towards prevention of diabetes and obesity, it actually doesn't make it to Pakistan. And you know that we've had those conversations. Just because, there's this fear that perhaps it's not a good country to invest in, and we don't have to get into the details of that. So we face a lot of these headwinds as well, just living where we are. The second question I wanted to have, perhaps, and very quick responses because I want to take one or two questions, please, from our audience as well, is, what vested interest do we have when we come to industry? A lot of the products that we use right now are used in specialized care. Would we not be better off in terms of preventing disease when we take these models to primary care, which is, of course, something that's not very well developed in our country? So what are some very quick comments as a response to this?
So the question is basically, how can we take it to the primary care level?
Prevention of NCDs, not your products per se, but how do you take this to the primary care clinics and the communities?
Again, I would go back to my initial statement. It's an ecosystem, right? Every stakeholder has a role to play. So industry has a role to play, government, policymakers, institutions, everybody has to pitch in. If you put the entire responsibility on the industry, it will not work.
No, I'm saying what are models that might work where industry is part of those models? What would those be?
There are multiple models. Like, we operate throughout the world. We work on innovation. We are working in Africa where we have Cancer Care Africa. Different models depending on the need. So look, what is missing is in Pakistan. Specific question, let's come to Pakistan. What can we do in Pakistan? So when we ask this question internally, so the first question is, okay, what is the vision of Pakistan? What is the healthcare gap in Pakistan? What can we do? We don't find any answer. You understand what I'm saying? 2-3 years back when we started the journey, AstraZeneca, by the way, is still not in Pakistan. We are setting up the business in Pakistan. But the first question was, okay, let's do something big in Pakistan. Do what? Should I give money to Aga Khan? Should we give the money to the government? Should we set up clinics? What? Data is missing. We don't know where the gap is. And industry, no, not as maybe, I don't know, but industry alone cannot do it.
Yes.
We need to start thinking strategically. We need to start looking at the gap. Where is the gap? Sure. Once we understand, then different stakeholders of the community can pitch in. Industry definitely has a role to play. We never shy away. Like, we invest millions and millions across the world, right? So, I'm sure Helion is similar. Like, everybody wants to invest. So we need to pitch ourselves to the rest of the world as well. That would be my question. And then, what needs to be done will be coming up or driving from what the need is. One side does not fit all. We cannot just say, okay, fine, something worked in, for example, Ukraine, and the same thing needs to work in Pakistan. No.
I was just looking at the color of your mic when you were talking about Ukraine. I think the other aspect of this is, I have the same one. I think the other aspect of this is the theme that's coming out is that if there could be some money that could be spent on even identifying the gaps as to what the current state of affairs is. I mean, we have some very unreliable numbers in terms of hypertensives, diabetics in the country. We don't have good data on lifestyle. How many people are actually walking even 4,000 steps a day, 5,000 steps a day? We don't have good amount of data related to that. So I think one of the messages here is that if industry can even spend some money on surveillance systems in Pakistan, because we know that the government may not have the resources because there are some other things that they need to take care of, I think would be a big initial step in terms of what can industry do to support those initiatives where there is surveillance that leads to data that is very reliable. Quite a bit of that work has happened in maternal and reproductive and child health, actually. There are numbers that we have right now are reliable, but I think in this NCD space, especially when it comes to lifestyle, we have no data whatsoever when it comes to our nation, and what we have is perhaps not as reliable. I think you wanted to make a comment.
Just about lifestyle. There's certain basic information that we all have. 1 out of 2 women and 1 out of 4 men in Pakistan have calcium deficiency. Right? We have that data. How many of us are taking that seriously.
Sure. So I'll tell you, when it comes to these things, look, these kinds of statistics you'll find in Pakistan. I think the question is, what is the most important priority right now? Are you going to basically worry about calcium levels when we have infant mortality? That's one of the highest. When we have diabetes rates, that's one of the highest. Hypertension, we are getting there. 10% of the heart attacks that occur in Pakistan, at least by rough estimates, happen even before the age of 40, when you can't even calculate a 10-year risk on someone, right? So I think my question to you in response to that would be, what am I going to worry about for the next 5 to 10 years? And do we have numbers for those that are reliable? I am not sure. Maybe you want to comment on that. Do you trust the data that we currently have in terms of even NCDs or chronic diseases? Any chronic disease, doesn't have to be cardiovascular, cancer, mental health, depression, COPD. Do we have data that are reliable? And perhaps I want to take one question from the audience then.
So I think cancer's GloboCan is a standard that we have. But look, again, I'll go back. The issue is we need to understand the patient journey. So for example, let's say if we talk about raising awareness on breast cancer or lung cancer. Okay, fine. Let's say if everybody in Pakistan is aware of lung cancer, right? What do they do next? Do we have the system? Do we have the diagnostic capability? Yes, no. No. Do we have the medicines which are required? All the medicines, like, do we have the state-of-the-art medicines? No. Do we have the testing facilities? I don't think so. Do we have the funds? There was a discussion on funds and insurance. Is it available? So what I'm trying to say is that we need to sequentially think, what is the patient journey? How many numbers are sitting where? Where is the biggest gap? What do we need to prioritize and start working on? Just like creating awareness it's not a panacea. It's not going to solve everything. You understand what I'm saying? So just imagine if everybody knew, everybody by the way knows lung cancer, right?
I'm not sure.
There's a lot of awareness on breast cancer and lung cancer. But what do you do next?
No, your point is well taken in terms of awareness is definitely not the only thing that works.
Yeah.
We have 2 minutes and 47 seconds left, so
Yeah, maybe
short comment, and then we'll go to the audience, take one question.
Maybe 1 minute and 15 seconds for me, just to touch
That
upon
will
the
leave
topic
1
that we
minute and
have.
15 seconds
Yeah.
for the question.
Exactly. So the topic actually, the take-home message I really wanted to give for you is we need to work on to the right mindset. That is very important, and how we can utilize this digitalization or to this technology for this awareness. Because the most important thing is we always talk about the data, we talk about the policies, about the structure, but nothing is changing right now. We need to change the mindset. I have a very clear example just for learning. We have Wasim Akram, the brand ambassador with us from the many years, and whenever we take them to the public, we'll say, oh, he's managing very well the diabetes, he's a rich person. And whenever we come across to the answer to those questions, managing the diabetes or to prevent yourself from diabetes is the most cheapest way. The only thing is the mindset is not clear. If you really want to give this message to me, to my family, to my colleagues, or to my surroundings, what you need to do to prevent from diabetes: eat less, walk more, do hard work, drink more water. What is the costly thing among all these things? It's nothing. It's the most cheapest way. So now we bring in a more poor patient now as a brand ambassador now, just to overcome this population mindset.
I'll leave this session with actually a proverb that summarizes what you just said, if I remember that proverb, by the way.
Perfect.
So we'll take a quick question, very quick answer.
I have a comment just to, complement what, speakers are saying. So according to American College of Lifestyle Medicine, 95% of the diseases are not supposed to happen if we follow a lifestyle. I'm fancying that maybe when we are, as a physician, when we are prescribing medicines to diabetes patients, could just like cigarette ke box pe likha hota hai ke, it can cause cancer, can we dare to say that your diabetes is reversible if you follow lifestyle? And then having a public awareness campaign that, a patient is much more motivated to reverse this and not take it to stroke, kidney disease,
Sure.
and,
So,
Please go
if I may, I know we're running out of time, and I'm very sensitive to the conference organizers. 10 seconds for each speaker, 10 seconds for each speaker to leave everybody with a message. A message, 10 seconds.
Message is only the mindset, just I echo your side, just to switch the button on and it can have a massive, just like in a KPK and a Punjab government, in the public school, they have stopped availability of the fizzy drinks for the children and they have reduced down. This is the policy, we need to work on that.
10 seconds for you.
Plan, collaborate, and make it happen.
Okay, super. That was 6 seconds. That's great.
I would also say the same thing. We need to look at every section, not just industry, not just individuals. Self-care is important, but it will have to be broken into a lot of areas. And then we'll be able to work on it.
Wonderful. And I'll leave you with this message. Actually, it came when you were talking about. So the secret to healthy living is eat half, walk double, laugh triple, and love without measure. So with that, we'll leave you all, and thank you for listening.